Hi everyone, my name is Rafi Hassan, and I am an OMS2 from AT Still University School of Osteopathic Medicine. So today I'll be presenting to you some of the work I did with the hand surgeon, Dr. Adam Bacher at Twin Cities Orthopedics, which is based out of Minnesota. So our work involved developing a new surgical incision technique to help excise a mucous cyst from a distal interphalangeal joint, or a DIP joint as it's commonly known. So a quick background on what a DIP mucous cyst is. They're a buildup of fluid in a finger joint found commonly in elderly patients, mainly as a result of underlying osteoarthritis. So as you can see in figure 1, there's a buildup of a cyst or a mucous cyst in the DIP joint right over here. So while many non-surgical options exist, like occupational therapy, aspirations, cortisone injections, and simply just waiting it out, a surgical incision often provides extended symptom relief with having a reoccurrence rate of less than 2%. So over the years, many surgical incision techniques have been developed to help excise the joint, like making an H or an S-shaped incision, all of which involve making a single incision directly over the dorsum of the joint. So as you can see in figure 2, there are many incision techniques you can utilize when excising the cyst itself, but the common theme in all of them is you're making one single incision directly over the dorsum of the joint. So while all these techniques have similar successful outcomes, a possible cause of reoccurrence has been linked to inadequate capsulotomy or access to both sides of the joints, with studies finding cysts usually occurring on either side of the extensor mechanism. So therefore, the double J incision technique was developed, which involves making two curvilinear incisions over the radial and ulnar side of the DIP joint, instead of the one typical incision directly over the cyst. So a retrospective review was then performed to see how healing rates, complications, and recurrence rates compared to past techniques. So now for the surgical technique itself, without getting too much into the detail, the main difference again involves making bilateral reverse J incisions over the extensor tendon mechanism of the DIP joint instead of making the one incision. So if you can see in figure 3, you're making two reverse J, one on the lateral side and one on the ulnar side, and having access to both sides of the joint. So after removing some of the soft tissue around the tendon and joint to gain access to the joint itself, a freer is passed underneath the tendon to ensure full access to the joint, followed by using a ronger to remove all osteophytes and cyst formations, repeating it on the other side as well. So once the osteophytes and cysts are removed, the incisions are then closed and dressed accordingly. And the post-op protocol is also similar to many of the other surgical techniques, involving proper wound care, early and often gentle range of motion and occupational therapy within 3 to 5 days of surgery, and then return to activities in about 3 weeks. And then for the results, as mentioned, this was a retrospective study reviewing about 82 patient charts who had a DIP mucous cyst excised. And then first of all, there were 0 wound complications and no post-operative infections. And an average of 1.75 therapy visits were needed to help maximize range of motion, with the right shift seen in this table mostly due to patients who require additional procedures like carpometaplasty or a different type of fusion, along with the DIP cyst excision. So there were 3 patients who did have a reoccurrence of the cyst, 2 of which were treated with cortisone injections and 1 with additional therapy, all having good relief as far as we know. And then in conclusion, after comparison and review of patient charts, the double J incision incorporates the limitation of the extensor tendon as seen in other incisions without compromising exposure to the joint, possibly risking other infections and issues. It also preserves vasculature dorsal to the extensor tendon, helping minimize recovery time and other wound complications, while also making incisions along the skin folds, allowing for minimal scarring of the incision. Therefore, the double J incision is a suitable alternative technique when excising mucous cyst excisions. Thank you.